Good morning and welcome from the Senior Law Day Collaborative. My name's Melinda Bellis and I'm an attorney in charge at Legal Services of the Hudson Valley. I'm also a co-chair of the Senior Law Day Collaborative. I share this role with Elena Falcone from the Westchester Library System and Sarah Steckler of Keen and Bean. You've joined us today to learn about how do I pay for long-term care, planning with and without long-term care insurance. But first, let me tell you a bit about the collaborative and the resources available to you. The collaborative is composed of more than 150 professionals who are all eager to bring authoritative information on legal, financial, and health topics to our county's older adults. We make available educational workshops throughout the year, as well as brief one-on-one consultations with collaborative professionals. You can connect with our resources and services through our website, seniorlawday.info. The site is a resource for information on legal and financial topics addressed by the collaborative. You can go there to watch the video recordings of prior webinars and to access printed reference materials such as our annual and excellent updated Elder Law Q&A. And you can send us your questions on any topic of concern to older adults. Just look for the Ask Us button on the site. Send us your contact information and a rough outline of your question. We will work promptly to connect you with the needed expertise. Now, before we turn to today's presenter, I would just like to tell you about a very special program that's coming up. As I just mentioned, the Senior Law Day Collaborative offers one-on-one consultations throughout the year, and we're planning to offer these consultations next week on December 10th. This is an opportunity to have a free consultation with an attorney, a financial planner, or geriatric care manager. So if you have any questions, I urge you to visit the seniorlawday.info website and register to speak to one of our professionals. Registration opens up on December 9th at 3 p.m. The consultations will be assigned on a first-come, first-served basis, and once all appointment slots have been filled, registration will be closed. So please sign up early if you're interested in having a consultation. And now a few points about the format in which we're working today. This Zoom video conferencing event is being recorded with the aim of posting the recording to the Senior Law Day site. You as participants are muted. You can, however, ask questions via the Q&A box on the bottom of your Zoom window. We may not be able to answer all questions that are posted, but unless you choose to ask anonymously, we'll work to follow up via email. You might also save your question for that Ask Us button on the seniorlawday.info website. And now I'll turn this presentation over to today's presenter, elder law attorney Deep Mukerji. Deep?
Good morning, everyone. Good morning. Wish I could see all of you, but I hear that there's a very large turnout, so I'm very thankful for that. So today we're going to talk about paying for long-term care. This is a kind of mystery. Long-term care is one of those things that nobody has actually really figured out how to pay for yet. So, Bruce, I'm not seeing my slides, but if I could go to slide 2, please. Great. Slide 2. Perfect. All right. Thank you. Okay. So why is this such an issue? Well, long-term care is extremely expensive. Okay. It's very expensive. Now, I pulled these numbers off of the Department of Health website. I feel like they're a little old and a little low. But they're saying, well, nursing home costs are $340 a day to $390 a day, which is about $124,000 to $142,000. So it's very expensive. No matter how much money you have, you're going to run out. So it is, quite expensive. Home care costs. I looked at the state average. It was $22 an hour. I think it's a little higher around here. I would probably say it's closer to 25. So that's going to cost you a bunch of money. Okay. Can I have the next slide, please? Thank you. All right. Well, Medicare. So we want to talk about Medicare. Can Medicare pay for long-term care? Well, I just want to give you a little background on the program, of the Medicare program. Medicare is a non-means tested program, okay? If you have paid into the system, you've paid the requisite number of credits. It's usually roughly a 10-year work history. If you have paid into that program, then you will receive Medicare. They don't care how much money you have, all right? So you can receive Medicare. It does have deductibles. It has co-payments. What does it cover? Well, it will cover a nursing home. It will cover a rehabilitative stay in a nursing home up to 100 days. The first 20 days, there is no copay. But after day 20, day 21, the copay becomes $176 per day. All right, that's in 2020. I believe it's going up. It traditionally goes up every year. So right now it's $176 per day after day 21. If you have a Medicare supplement policy, some supplement policies, depending on which ones you have and what level you have, it could be it could cover some of that copay. All right. Does it cover home care? Well, it will cover home care with a rehabilitative component. All right. It will cover certified home health agency, or CHA as we refer to it. Now, I'm going to talk, I'm going to throw some alphabet soup at you, just because there's a lot of, and there's a lot of acronyms that are involved in this business. So, but just bear with me, and if anybody needs any clarification, you can ask me. But Certified Home Health Agency, CHA, for example, Visiting Nurse Services is a certified home health agency. So these provide skilled care and rehabilitation. They can provide therapy, but the hours are going to be limited. In general, Medicare does not cover long-term care, all right? Does not pay for long-term care. Can I have the next slide? Thank you. All right. So let's talk about home care. The home care is very popular. It's used widely in New York. So generally, you have, first of all, licensed agencies, and these are called LHCSAs, Licensed Home Care Services Agencies, LHCSAs. These are generally privately paid. They're licensed through the state. Again, that average is what the state says is I guess it's a statewide average for an hourly rate. It's $22 an hour. Okay. So if you need, significant home care, well, it's not going to cover, it's going to be pretty expensive. So some of this may be covered through long-term care insurance, which is what I'm going to talk about in a little bit. All right. There are a number of Medicaid programs that will also provide home care. They provide managed long-term care, personal care. There's something called the Consumer Directed Personal Assistance Program, which allows you to hire your own aide and direct their activities. There's adult daycare services where people can go for the day and they would receive care as well as socialization. There's something called the PACE program, which is a program of all-inclusive care. It covers everything. All right. And then there's a special program in Medicaid called the Nursing Home Transition and Diversion Program, which could provide all of these kinds of services. They can provide home care. They could provide, home adaptations. There's many different things that can be provided under that program. Next slide, please. Thank you. All right. So the need for home care. The need for home care is generally predicated on something called the activities of daily living, or ADLs, all right? these activities of daily living. Do you need help with these? If you need help with these activities of daily living, you will generally qualify for home care coverage. All right. What are the activities of daily living? These are the ones that we commonly refer to. It's eating, bathing, getting dressed, toileting, transferring, and continence. All right. Now, those, if you need help, if you need assistance with these activities, you will generally qualify for home care. Now, under long-term care insurance, usually the requirement is that you need assistance with 2 ADLs, all right, 2 activities of daily living. If you need assistance with 2 of these categories, then they will generally authorize care. Medicaid has not had anything previously regarding ADLs. All right, there has been no requirement for ADLs previously. All they just said was medically necessary services. Now, there is a new law that was passed in 2020 that would require that people need assistance with more than 2 ADLs, or if there's a diagnosis of dementia, they would need assistance with more than 1 to receive managed long-term care. This was actually effective in October 2020, but it says likely, but it actually has been pushed back to April 2021 at this point, mainly because of the public health emergency. There is because they would lose federal money. The state does not want to implement this. Now, if the public health emergency gets extended past April, then that date could be pushed back again. There have been new regulations that have been proposed that incorporated the ADL requirement. And there's also going to be a new assessment performed by people. There's also, under these new laws, there's going to be an independent panel that's going to review cases that are considered high utilization cases. That means cases that it's generally understood are more than 12 hours a day. So if somebody needs more than 12 hours per day, there's going to be this medical review panel that's going to look at cases and say, well, are they appropriate? Now, we don't really know what that means. Does that mean that they're going to steer people who need a lot of care into nursing homes? That's not generally what we want to see, and it's not generally what the state wants to do. Nursing home is being a more expensive level of care from one point, and also obviously not something that everybody wants. So we hope that they come up with better alternatives, perhaps a combination of different kinds of services that would that would take care of people with more than 12 hours a day. You also notice in terms of the ADLs that ambulation is not there. So and that's something that actually we have commented on. The legal community has commented on. We think ambulation should be in there. Helping people to ambulate, whether it's with a walker or whether it's independently. There should be some of that. That's always was understood as being something that people need a home care aide to do. But that's not there. There is transferring, that would be transferring to a wheelchair if someone is wheelchair bound, transferring from a bed to a wheelchair, transferring to a walker. So that is there, but ambulation is not included. So anyway, those are the activities of daily living. Next slide, please. All right, so what if we talked about home care? What are the residential options? All right, what if you can't, if you don't want to live at home any longer, or you want to or you're not unable to live at home. So there are assisted living facilities, and there are all kinds of assisted living facilities. Some of them are licensed under different kinds of licenses. They'll generally provide room and board and care, and some care. All right, it's not going to be extensive skilled care. It's generally in the area of home care, a home health aide, or some kind of shared aid situation. That's what most assisted living facilities are. Most of them are private pay. There are some that are covered by Medicaid. The assisted living program is a Medicaid program that is covered. There's also adult homes, which is considered independent living. In adult homes, generally room and board is provided, but no care. And in these kinds of places, you could hire your own aide. You could privately pay for an aide. You could use long-term care insurance to pay for an aide, or you could get Medicaid to pay for an aide. Okay, there's also continuing care retirement communities. All right, these are all exclusive. They're generally private pay. There is no public assistance available for those. They're also very expensive. We have the example that I could give you is the Osborne in Rye is a continuing care retirement community. Generally, what happens in these kinds of places is that you pay a fairly large deposit up front. Okay, you pay a bunch of money, and then and then you have to pay a monthly fee, a monthly fee. The monthly fee varies from place to place, and it also will vary depending on what kind of care that you're receiving. So with these continuing care retirement communities, they're going to encompass independent living, assisted living, and nursing home. They have everything there. All right. It's basically you pay one price and we take care of you for life. Okay. That's what a continuing care retirement community is. And then finally we have skilled nursing facilities, which is your basic nursing home. All right. And those can be private pay, Medicare, or Medicaid can pay for these. Next slide, please. All right, so let's talk a little bit about long-term care insurance. So long-term care insurance can help to pay for all these things. So it could be very helpful to defray the cost. Like we said, it's very expensive. And if you get long-term care insurance, you may be able to pay. It may be able to help you with the cost of home health care, assisted living, or even a nursing home. Generally, the way these long-term care policies work is they can provide reimbursement, meaning you pay, say, if you got a home care aide, you'll have a home health aide, you pay for the home health aide, and then you submit the bills, and they reimburse you. Okay. Some policies will pay providers directly based upon authorized amount, hourly amount, or it could be the policy limit. Some provide just a fixed payment. Okay. Some just say, well, if you need care, we're going to pay you $50 a day. All right. And that's what you get. And they'll just give you $50 a day. So this all depends on what kind of a policy that you have. So, you want to review your policy. You want to look at what the benefits are. Usually there's an elimination period, and it's generally 90 days, which means that from the time that you need the care, you have to wait 3 months before the coverage will kick in. All right. So if you're in need of care, you probably should have some funds available to pay for that elimination period. All right. There's going to be this 3-month waiting period before you actually receive the coverage. All right. Your premiums, they're going to be based on your age. They're going to be based on your health conditions. Any pre-existing conditions may be taken into account. Now, there's these things called inflation riders, and the inflation rider would generally provide that the benefit amount, let's say it starts at $50 a day, will go up over time, and it will go up by a certain percentage. Generally, state approved policies provide for, like, I believe it's like 3.5% set by the insurance department of the state of New York. So 3%, it's an additional purchase. All right, it may not be part of the original policy. So, but you certainly want to look at this. You certainly want an inflation rider if you're considering long-term care insurance, because the costs go up every year. The price is going up for long-term care. All right, these costs are all rising. So you may find, if you don't have an inflation rider, that your long-term care insurance is not keeping pace with the actual cost of care. That's why the rider is important. Also, and I think most policies have this, they have a premium waiver, which means once you start receiving the benefits, you don't have to pay premiums anymore. All right, from the day that they approve you for care, for coverage, then you can waive the premium. Now, for certain qualified policies, New York State is offering a tax credit. All right, there's a tax credit. Now, these rules have changed a little bit, but I believe right now it's up to $1,500 is the maximum credit that you can get off your income taxes for paying long-term care policy for a long-term care policies. All right, but it's not for every policy. It's just for a qualified policy.
Excuse me, Deep. Can
Yes.
I interrupt with just a new question we have?
Okay.
Someone is asking, for the Osborne, how much do you pay up front and how much per month?
Oh, I don't know. I've heard different amounts. I think that a few years ago, I had a client that paid about $500,000 up front, and then it was a couple of thousand. A lot of these vary, and they vary over time. As time goes on, they change. But like, it's a fairly large lump sum payment that's generally required up front. The situation right now may be better just because of the public health emergency. A lot of these places, to entice people, are reducing their prices a little bit. So the qualified, I saw that one. I'm not seeing all the Q&As, but that particular one, I think it was on chat. I saw a qualified policy. You'd have to consult the New York State website. All right. There's certain policies that are qualified. I would also, if you're talking to a long-term care provider, if you're looking to a long-term care insurance provider or a broker, you want to ask about which ones are qualified. You want to say, I want one that gives me the tax break. All right, but not every policy will be qualified.
We have one more question.
Okay.
Does the waiver period include time you might be in short-term rehab after a hospitalization or when you actually get home?
It depends on whether the benefits would have been available to cover that period. All right. If the benefits are going to be available to cover, would have covered part of that rehab stay, where you could have gotten some benefits during that time, then that will count as part of the elimination period. Otherwise, not.
Thank you.
Okay. All right. We're going to move to this next one. Okay. Thank you. So there is a program called the New York State Partnership for Long-Term Care, and this started in 1993. And this program offers policies that are a little different from the policies that from regular policies. They're in combination with New York State, and the aim of these policies is to allow people to protect their assets, all right, at certain levels. Now, to know if your policy is a long-term care policy, it has to have that logo that I put on the slide. All right, that little logo will be on the actual policy. So look for that. If that logo is not there, it's not a partnership policy. All right. So under this program, it's got the traditional. You set up. There's coverage available. There's benefits payable. It could be for home care, assisted living, or for nursing home. All right, there'll be levels, and depending on how much you've paid in premiums, there will be a certain benefit amount that's available. Once that benefit amount is exhausted, once you have used it up, and they will give you a letter. Actually, they give you a letter. I believe it's 90 days in advance, telling you that your policy benefits are starting to run out. Say, and I said put it 5 years of home care. That was like sort of a traditional thing that you buy 5 years of home care, or 3 years of nursing home care. But it could vary these days. It all really depends on what kind of a policy you get. Okay. But there's a dollar amount. There's going to be a fixed dollar amount, which comprises your benefits. So after that has been exhausted, the policyholder can receive Medicaid automatically. All right. An application would still have to be submitted, but they would automatically qualify for Medicaid, regardless. If you have a total protection program, it's regardless of your assets. You could have $5 million in the bank. Medicaid will not care. All right. That's a total protection policy. All right. But those actually have become so expensive that they become less attractive as an option. And what people are doing are buying these policies called dollar for dollar, which means you can choose to protect a certain amount of assets. Let's say $500,000. All right, so it's like I want to preserve $500,000, and you can buy a policy that will allow you to do that. That means that you will get Medicaid automatically, provided that you have $500,000, that up to $500,000 in assets. So that is, that's an option for people to protect assets. If you have assets that you want to protect, then it may be worth looking at one of these policies so that you can receive your Medicaid paying for your long-term care, and still keep some of your assets. All right. Now, it's an asset protection policy. It does not protect income. All right. So if you're in a nursing home, your income will still have to be paid to the nursing home before Medicaid will pay. All right. So whatever your income is, your Social Security, pensions, interest payments, things like that, will all be counted as income that need to be paid towards your care before Medicaid will pay. So that's after the policy is exhausted and Medicaid is kicked in. All right. So here's an issue that people always ask about is portability. What does portability means? Portability means can I move to a different state? All right. This is the New York State program. Can I move to a different state and still receive that automatic Medicaid? And the answer is only for limited states, in limited conditions. There has to be a participating state. The other state has to also participate in the program, and then so that's something that would have to be checked before you actually decided to move. In other cases, you may be able to move to a different state and then come back to New York to receive the Medicaid benefit. All right. Was there another question?
Yes. What is
Okay.
the typical age limit for qualifying for a long-term care policy? I'm already 72 years old.
Yeah, I would, it may be possible to, as you get older, um, obviously the premiums go up. All right, it gets more and more costly. So depending on, you still may be able to receive to get a long-term care policy at age 72. And if you're in good health, that would certainly be a factor. Uh, but there's no actual limit. But in practical terms, the older you get, the harder it will be to receive to get a policy.
Thank you.
Okay, I think we'll move on to the next slide. Are there any more questions? No.
No.
Okay. Good. All right. Great. So, and now I'm really going to talk about Medicaid for a bit, because Medicaid is the largest provider of long-term care. All right. Now we looked at these things, and some of these are going to pay for, some of them will work for people, but overall throughout the country, Medicaid is the largest provider of long-term care. And Medicaid is the payer of last resort. Now, I just wanted to say this about long-term care. People have talked about it for years. How do we cover long-term care? Congress has passed laws, they've done all kinds of things, but they've never really figured out how to do this. Now, President-elect Biden has said that he was going to include long-term care in his public option. So, we're hopeful. However, given the cost, it's become very difficult. Government has not really figured out how to do this. So what happens is, well, if there's no one paying for it, then you have the payer of last resort. And that is Medicaid. Medicaid is a payer of last resort. If there is nobody left to pay, then Medicaid will cover it. All right. And if you need long-term care, then Medicaid will pay for it. This is why the discussion of Medicaid is very frequently the focus of paying for long-term care. All right. Now, what is Medicaid? So unlike Medicare, Medicaid is a means-tested program. You cannot have too much money. All right. There are limits on income and resources. All right. Income is how much you got coming in. Resources are your assets. What do you have in the bank? All right. Now, Medicaid will cover all these different things we talked about, different programs, nursing homes, adult daycare, home care, the consumer-directed program. So there's a bunch of programs in Medicaid that cover long-term care, and it is long-term. It's chronic care. If you need the care, they will pay for it. Okay. So what are the limits? The limit in 2020 is $875 a month. All right, $875 is the income limit. For a couple, it's $1,284 if they're both applying. All right, and there's a $20 unearned income exclusion. Okay, so effectively $895. All right, and I'm going to revisit this. So I just want to give you these numbers first. For managed long-term care, which is generally the home care, most long-term care, home care in New York is provided through a managed long-term care program. Managed long-term care is like an HMO. You have to enroll with a managed long-term care provider, and they will arrange for home care, and they also approve your hours. They tell you how much they're going to cover, and then they make the arrangements for you to receive this coverage. Now, if you are a non-applying spouse, the non-applying spouse gets to keep $32.16 per month in income, and the applying spouse can keep $409. All right, instead of the $875, it's $409. That's if you have a non-applying spouse, you have one spouse who needs care, you have one spouse who doesn't need care. The one that doesn't need the care gets to keep about $3,000 a month, and then the applying spouse only gets to keep about $400. So if you have excess income, though, if you have, I mean, because really, who can live on $895 a month? All right, that's a very low number. If you have excess income, well, you have this option. You can pay it towards the cost of your care, and that's known as a spend down. All right, it's very, that's a term that gets used a lot. That you have a spend down, and that would mean that you have income that's more than the Medicaid income limit. However, you're paying it towards your care. You're only keeping the 875 or 895. You're keeping that, but the rest of it you're giving to your medical provider for your care. It could be actually a spend down can be on any medical bills. So as long as you're spending it on those, then you will still receive Medicaid even though you have excess income. Again, 895 or 875 is a very low number. How do you pay rent? How do you pay your mortgage? How do you pay, it's very, in New York, it's, that's just not enough money to live on. So, and most people are earning, more, and they get more than that. So, the surplus income can also be paid to a pooled community trust, which is a special kind of trust established for disabled people. And once that surplus or the spend down gets paid into a pooled community trust, it can be used for non-medical needs. All right, the medical needs are being covered by Medicare and Medicaid, but and insurance. However, if you have non-medical needs, rent, food, Con Ed, the phone bill, these things can all be paid through the pooled community trust, and that is a way to preserve your income. I saw that there was a question.
We have a few questions.
Okay, let's address it.
So first, we have a 4-year policy. What is the average length of stay in a nursing home?
Well, I think that on my slide, I saw that they say 2.5 years. That's considered the average. I would say it's probably 3. However, people are living longer these days, but I would generally say that the usual length of stay in a nursing home is around 3 years.
Is the income limit of $875 or $1,284 per month or per year?
That is per month. That is a monthly limit.
And how does $1,284 for a couple eligibility square with the non-applying spouse keeping $3,216 a month?
The $1,284 is when both are applying. If they both need care, then and they're both applying together. If a couple is applying together, then the $1,284 is the number that's used. Now, generally, this doesn't really make any sense. It's just it's set by regulations and laws. So people would try to apply individually and at least get like the 875 or 895. But if somebody if they each got that, then of course they would get more. So like I said, it really makes no sense. But that's if they both needed care. If only one person needs care, then the person who's not applying gets to keep the $3,216.
And picking back on long-term care insurance, what is the best age to start long-term care insurance?
Well, with long-term care insurance, the younger you are, the less you will pay. All right. So if you start at a very young age, depending on how much disposable income you have, it will be a much lower number. All right. The premium will be much lower. As you get older, the premium is going to go up. So, so it's advisable to start to look at long-term care insurance when you're able. when you're able to sort of afford to put that money aside. And the other thing is you have to have assets that you want to preserve. All right. If you have some assets that you want to preserve, then long-term care insurance really makes a lot of sense.
And the last thing in the chat was, what is considered income in this case? Does it include Social Security, savings, or assets?
Okay, it doesn't include assets. It does include Social Security, pensions, your IRA distributions. Okay, it includes interest. It can include distributions from a trust if you use a living trust. The distributions from that will be considered income.
And one last one, how much can you have in resources in order to apply for Medicaid?
Oh, that takes us to our next slide.
Okay.
So we'll go to the next slide. All right, so this is assets. This is the resource side of it. All right. Again, income on one side and then resource limits on the other. And yes, I should have clarified before that we're talking about income. Medicaid always works on a month-to-month basis. All right. So the resource limit is $15,750. That is how much you are allowed to have in the bank if you're applying for Medicaid. $15,750, and this would be, say, savings, what's in your checking account, investments, stocks, bonds, and it can include the cash value of life insurance as well. It's $23,000 for two people if they're both applying. Again, if you have for the managed long-term care program, which is a home care program, and for nursing home, a community spouse, meaning a spouse, excuse me, a spouse who is not applying. All right, a spouse who is not applying for coverage can keep up to $128,000 in assets. All right, the applying person, the person who needs the care, can keep $15,750, and the person who's not applying, the spouse, can keep up to $128,000. All right. If the not applying spouse has more assets than that, all right. If the not applying spouse has more assets and would make the applying spouse ineligible, then the spouse can refuse to provide support. All right. They can submit a letter saying that, I'm unable to pay for my spouse's care, and then the applying spouse will receive the coverage. However, there is a legal obligation to pay for a spouse, so that the state or the county can actually bring legal action for spousal support to recover what they're paying. All right, they'll approve the Medicaid. They'll say, all right, we'll pay for your care. We'll pay for your care. Your spouse is refusing to provide the care, to pay for your care. So we're going to pay for it, but then we're going to go sue the spouse to get that money back. It's a spousal support action, and a little bit like child support. All right, looks like we got more questions. Okay.
Thank you. Okay. If you start paying for long-term care when you're young and years later the company closes, is the money you put in insured? Is it paid back, or did you just lose it all?
That really depends on the policy. That depends on, and it's going to depend on whether it can be converted to a private policy. If you got a group policies, if the company is gone, are we talking about? I'm sorry, it's hard because without the interaction, it's like, are we talking about the insurance company that goes under, or the employer?
I'm guessing the insurance company.
Oh, okay.
But that's a guess.
Yeah, the insurance company. Well, we've had situations where a lot of long-term care insurance companies have gone out of business. They've generally been able to transfer their policies, all right? And so in general, people have been able to continue to maintain their policies. And I would say that that's still, that is still generally what's going to happen. I mean, these policies are all overseen, the oversight of these policies is all through the New York State Insurance Department, and they supervise them, they regulate them, and they try to make sure that people don't get hurt by, for example, the bankruptcy of a company. And generally, I'm most of the cases I'm aware of, people have been able to do that. All right.
I'm sorry, one last question, and then we're not going to have any more questions until the end.
Okay.
What is, because this is a big one, what is MLTC?
MLTC is managed long-term care. That is the Medicaid, that's the Medicaid program that pays for home care. All right. Most home care is provided, with the exception of a few special programs. Most home care is provided through managed long-term care. All right. Yes, time is getting. I'm sorry, guys. This is it's very complicated stuff, and I'm throwing a lot of stuff at you. So I appreciate that you're paying attention and that you're asking me all these questions, because it is, and I admittedly am moving quickly because I want to cover a lot of material. All right. So here's the thing we're going to talk about transfers a little bit. All right, because that becomes an important thing, and it's very misunderstood. So I just want to clarify that for people a little bit. All right. So what is a transfer? The idea of a transfer is that that you have given away. Actually, can I just skip to the next slide? I think that's okay. All right. So here, this is it. What is a transfer? So a transfer is an uncompensated. It's an uncompensated gift. It's like when you have provided something to somebody for less than fair market value, or you've given funds outright. You've given something outright. Okay. Now, because of the asset and income limits associated with Medicaid, people tend to say, well, if I give my money away, if I give my money to my kids and they take care of me, then I can qualify for Medicaid if I have less than 15,000, or maybe I can put it in a trust. All right, that's another common option. Can you do that? Well, you can, but there is a period of ineligibility. Now, under the current laws, there is no transfer penalty for home care. All right, for home care, there is not a transfer penalty. It's a little bit complicated, but the law is changing on that. Okay, and I'm going to talk about this more. But in general, and for the past, at least 20 years, there has been a period of ineligibility that you would create for nursing home coverage. All right. So nursing home coverage has always had this transfer penalty. If you gifted money, if you gave your money away, if you established a trust, all right, those were all transfers. And that would mean you would be ineligible for nursing home coverage. All right. Can I have let's see. Yeah, the next slide, please. Sorry, I'm trying to move a little bit fast. Okay. So here, now, the look back period is the period during which if you made a transfer, you would get a transfer penalty. All right. 60 months has been the look back period for nursing home coverage. There's a new look back period of 30 months for home care coverage under Medicaid. All right, this is a brand new thing. Now, this was passed under the laws of 2020 during the state budget season, and it was effective October 1st, 2020. However, because of the public health emergency, because of the COVID, it has now been the implementation of this look back has been pushed to April 2021. All right, so there's not going to be a look back for home care until April 2021. However, what they've said is that the law became effective October 1st, 2020. That means if you made a transfer after October 1st, 2020, so say you did it last month in November, if you did it in November, then that transfer could affect your coverage if you apply, say, after April. Say if you apply for home care in May of 2021, they will, when you apply, they will look back, and they will look back to October 1st, 2020. All right, that's the new law under that. All right, it's a little complicated, and it still has moving pieces. We don't know all the information on this yet, but this is what the state has indicated, that they will look back to October 1st, and they will keep looking back to October 1st until they reach 30 months. All right, so 30 months from October 1st, 2020, there's going to be this look back. All right, so I will go back to October 1st. After 30 months have passed, it's still going to be just 30 months. So we'll see, but it's 2.5 years. 2.5 years from October 1st, 2020. This is going to be, that means that with the look back, all the financial records have to be supplied. All right, financial records have to be supplied. And if there's any gifts or any transfers, if there is a transfer into a trust, then those could affect care. A penalty period will be imposed. All right, next slide, please. How much time do I have? We're getting there. All right, I'm sorry, guys, I'm moving very quickly. All right, so this is for nursing home coverage. It's 60 months. All right. Generally, they're going to look, when they look at all this financial documentation, that means all these bank records, investment records, things like that. They're going to be looking at transactions over 2,000. That's generally the state standard. If it's under 2,000, they're not generally not going to question it. However, if there's a pattern of, it's $1,000 a month to the same person, then it could be questioned. All right, but generally it's going to be transactions that are over $2,000. Next slide, please. All right, so this is another one that's a little bit complicated, but it's when does the penalty period start? All right, so you have to be what's called otherwise eligible for coverage in order for a penalty period to start. Otherwise eligible means that you're actually, you're either in a nursing home or you're receiving home care that would otherwise be covered by Medicaid. That part is brand new, and we don't know exactly what that means. But you'd have to be resource eligible for Medicaid, meaning that you have less than $15,000, $15,750 in assets, and your Medicare is exhausted. Medicare is not covering it, which it doesn't cover. Chronic care. Your insurance policies are exhausted. You could still be receiving long-term care insurance. All right, you could actually still be receiving long-term care insurance. However, if it's not sufficient to pay for your care, for instance, if you have a long-term care policy that's paying $250 a day towards a nursing home, but the nursing home now costs $500 a day. you're still going to be eligible for Medicaid because the cost of your care is more than the insurance benefit. All right, so that's otherwise eligible. You don't have any assets. The cost of your care is exceeding your income. It's exceeding your available benefits. Next slide, please. All right, so I'm just going to give you a very quick example, and I think we're going to just probably end with this one. So the way this kind of works, I just want to give you a little bit of, just an idea of how it is. Again, very complicated stuff. It's very hard to cover in this kind of time period. So let's say that you had $128,000 and $128,050, and you wanted to qualify for Medicaid, so you gifted it. All right, you gave it away. You gave it to your kids, and you did that in May 2021. All right. So what they do is they take a regional rate, which is set every year, and this year in Westchester, it's $12,805. So what they do is they take the amount transferred and divide it by this regional rate, which is the average cost of a monthly cost of a nursing home in the area. Okay, it's $12,805. So if you had gifted $128,050, they would look at it, they would divide it by the regional rate, and you would end up with a 10-month penalty period. Okay, so that means 10 months from the date that you were otherwise eligible. What we were just talking about, 10 months from the date that you're otherwise eligible, meaning that you applied, you applied, you have no assets, you need the care. All right, otherwise eligible, but you transfer this money, so they're going to say, well, yes, you qualify for Medicaid, but you transferred money, and because of that, you are now facing a penalty period, and the penalty period would start from the date that you applied and you're otherwise eligible. So with a home care, again, it's going back to October 1st, 2020. That would be the look back. For nursing home, it's 60 months. Because there was that transfer during that look back, you're going to get a penalty. So the penalty would be when you're actually applying, and in this case, it's 10 months. You're applying in November. If you applied in November, it would end on August 31st, 2022. That's 10 months. All right. So you would then be eligible, and I pushed these dates out because of this, because of the abeyance of the penalty right now for home care. I just wanted to give you an example that's in the future. So the person will be eligible in September 2022. That's pretty far along. All right. So one has to be very careful. You got to be very, there are a lot of different things you can do, but it's very tricky. My next couple of slides cover a lot of exemptions. That not every penalty not every transfer creates a penalty. There's certain assets also that are exempt. I mean, your home, if you're living in your home, it's exempt. Okay. You can transfer funds to your spouse. You can always transfer between spouses, or there's no penalties for that. All right. You can make transfers to a disabled child. You can in certain cases make a transfer of the home to a caretaker child. There's also transfers to disabled people or to trust for disabled people. And I think I'm going to end with that. The slides are all going to be on the website, and I thank you all for joining me today.
Thank you, Deep. This was really, really excellent. It's such a complicated subject, and you were very thorough and as clear as it's possible to be with this topic. So thank you. And just to let everyone know again that the recording of this presentation will be available on the Senior Law Day website, along with a copy of the slides. And please remember, I don't see, let me see, do we have more questions? Nope. Or is there one thing? No, I think that's it. So if you have any other questions, you can still use the Ask Us button on the website, and we will get back to you. And with that, I'm going to turn it over to my colleague, Bruce Seal.
So at this point, I wanted to just thank again the presenters and Melinda again. And what I'm going to do is also just really quickly thank our sponsors. These programs would not be possible without the support of our sponsors. They're also listed. I think I'm having technical issues here. They're also listed on our website. I wanted to remind people that again on next Wednesday, you can sign up if some of these questions you wanted to speak to an attorney to go through this in more detail. You can sign up on seniorlaw.info on Wednesday, December 9th at 3 p.m. for a consultation next Thursday morning. So mark that in your calendar. Thanks again, Deep, for your time.
Thank you. Thanks, everyone.